Hello, so the patient today has had an anterior hip replacement and we chose the right side. Hi, are you Nicole?
Yeah.
Hi Nicole, my name is Michelle. I'm an occupational therapy assistant student. So I understand you've had hip surgery on your right anterior hip?
Mm-hmm.
Okay, so today we're going to work on you with some bed mobility, get you moving around, up and down, side to side. We're going to have you sit up in bed, all exercising your safety precautions. We're going to put on your pants, put on your socks, and put on your shoes today. How does that sound? Good?
Good, I'm underwear.
That's okay, that's why we're going to put pants on you. Alright, so let's begin. Wash hands for 60 seconds. Okay, so first we're going to work on some bed mobility with you. Some things you have to remember that you cannot do. You cannot cross your midline, so no crossing legs, no crossing feet. You cannot externally rotate your hips, so that means you can't move it outwards. So basically you just want to keep your leg as straight as possible. And you also can't extend your hips, so no moving them upwards. You need to move your body as a unit, so no hip hiking or anything like that. So the first thing I'm going to have you do is come up slowly onto your elbows, but be careful not to flex your hips. Okay. Well, I'll edit this part out.
90 degrees. I can't go straight up.
Why does it say stand? That makes no freaking sense.
I don't know. Just try not to go like, you can't go past.
Just go. Okay.
Don't bend your, just say don't bend your lips.
Don't bend, okay. Alright, so first thing I'm going to have you do is move to the end of the bed. So you move your body as a unit to the end, and again, watch that leg, yep. Yep, and do not move your hips past there. So, good job. Okay, can you go back to the top now? Very good. Way to watch those precautions. Okay, now we're going to do the same thing, but this time it's going to be from side to side, so be careful not to hip hike, so don't bring your hips higher than they should be, and use your upper extremities to lift yourself. And that relieves that other good leg too. Okay, good job. Now come back. Alright, how did that feel?
Good.
That felt pretty good? Okay, you did a good job. Alright, so now we're going to have you sit up and you're going to do the same thing. Don't cross the midline with that hip, no rotation, anything like that. And you're going to move your body as a whole when you try to sit up and really watch your hips, okay? Alright, let's do it. Yep. Watch that. Okay. Good job. Now I'm going to put a gait belt on you, and this is just to ensure your safety. It's a very beautiful one, isn't it?
Yeah.
I'm going to make sure it's nice and high so we're not affecting that hip at all. Okay, how does that feel? Pretty nice?
Mm-hmm.
Okay, good. Okay, so the first thing we're going to have you do is put on your socks today. So I brought for you a sock aid, and how this works is you're going to take the sock and slide it onto the sock aid, like so. And then you're going to use the handle and slide your foot in there and then pull it up, and the sock should slide right on. And when it does, you need to still make sure you're maintaining your hip precautions, okay? So don't bend at the hips and don't rotate or cross these. You want to give it a try?
Sure.
Okay. Let's do it. So yep, drop it down there. Yep, and slide your foot inside. Yep, watch those hips. Okay. Careful, don't rotate your leg. Keep it straight. And then pull it up. Very good, just like that. Yep. Here, we'll get that off your leg. Now you try putting it on this one. Okay, slide it on, stretch it out a little bit. Careful, don't bend at the hips. Make sure you stay back. Okay. Yep, pull it on a little more just to make sure you really get that sock on. Okay, now do the same thing. Slide your foot on in and pull it up. Okay, good job. How'd that feel?
Easier.
That was easier? Do you have any questions about using the sake?
No.
No, that felt good?
Yeah.
Okay. The next thing we're going to have you do is put on your pants. So I brought your pants with you, and I also brought along what's called a reacher. So how the reacher works is it has this little trigger right here, and it kind of grabs like a crab claw. Do you see that?
Mm-hmm.
Okay, so we're going to put your pants down there, and you're going to use the reacher to put them on, and still make sure you're not bending at the hips or anything like that. So we'll set them down there. Okay, yep, good job. Just like that, and start maneuvering. Look at you, you're such a pro already. Yep, use that reacher and pull it around your foot. Just make sure you don't rotate your hips at all. Keep them nice and straight. Okay. Yep, get the other leg in there before you pull them all the way up. Okay, very good. So when we're going to have you pull them up, we're going to have you stand to get them all the rest of the way up, but I'm going to use a walker, okay? Okay. So we're going to set this in front of you in case you need it. So again, when you stand up, you need to stand straight up and make sure we don't cross those hips over the line at all. Ready? Okay, up. You do it. Yep, support with your arms. Good job. Way to stay nice and straight. Okay, you can pull them up the rest of the way. Okay, yep, sit back down again. Oh, careful. Don't bend at the hips. Okay, good job. Last thing we're going to do is put on your shoes, which I have right here for you. And I also have a shoe horn. So the shoe horn you're going to use and kind of maneuver it, put it in the back of your shoe to put it on.
Okay.
Do you have any questions about this shoe horn?
Mm-hmm.
Okay.
No, I got one.
So use that kind of like as an extended hand. Yep. Put your foot in there. Careful not to rotate the leg while you're getting the shoe. Well, good job. It's going on nice. Careful with the hip. Don't rotate. Alright, looks like that one's on. Want to try the other one too?
Yeah.
Okay. Alright, how did that feel? That was really good. You did a really good job. Yeah, let me take those quickly. Okay. Do you have any questions about anything that I just showed you? Sockage, shoehorn, the reacher at all? No?
Glad to be in pants.
Glad to be in pants. I'm glad to see you in pants, to be honest. Okay. So, do you have any pain during that treatment at all, or did that feel pretty good?
Just a little.
Just a little bit. Okay, that's common. That'll be all right. All right, so again, just make sure when you're moving around in bed and using these equipment, you always make sure to maintain those precautions so that your hip heals nicely and you can get back to your old self in no time. Okay, I'll see you next treatment then, and we'll work on the same things to see how much you learned, okay?
Okay.
All right, goodbye, Nicole.